SEPTA, or the Southeastern Pennsylvania Transportation Authority, is cutting their services drastically, and let's talk about what that means for disabled Pennsylvanians in Philadelphia. My name is Maddie, and I live in Philadelphia. I'm a disabled advocate and activist, and I use public transportation to get around the city quite often. So for some context, SEPTA announced that they're cutting their services by almost half, by 45%, and raising fares by more than 20% due to a lack of funding, state funding. And these first rounds of cuts are going into effect next month on August 24th, which, if you know anything about the end of August, it happens to be when a lot of people are going back to school, whether it's high schoolers or college or whoever, and a lot of these people utilize public transit. And a lot of news within the past 24 to 48 hours has covered the fact that a lot of these people are just simply not going to be able to get to where they need to go because their routes have been completely eliminated. And to give you some numbers about that, from the SEPTA website, it says there's 50 eliminated bus routes, 5 eliminated regional rail lines. So those are the rail lines, so the trains that go to and from, well, not just to and from Philly, but, kind of from the suburbs and around. 20% reduction in all services on all remaining routes. 9 p.m. curfew on the metro and regional rail lines. Elimination of special services such as Sports Express, that also includes paratransit. And 66 station closures. On CBS News' website, it talks about eliminating 3,000 bus stops, slashing the service system-wide by 20%, and removing 36 bus routes. If you know anything or have, navigated the SEPTA system, it's good, but it's not the most robust, reliable system already. There's not an easy way to cut things, or a way that reduces how much damage these kinds of cuts are going to inflict on the SEPTA users themselves. In addition to the fares being raised by 20% for the general services, those fares are going to be raised by 35% for paratransit users. So 20% if you can use the regular services, but 35% if you use paratransit. So just an example of the CRIP tax going on there. And on cleanair.org, they kind of do a deep dive on how it's going to impact marginalized folks. And they say up to 40,000 paratransit trips per year will no longer be served by SEPTA access. SEPTA claims, according to a article by WHYY, or Y, I don't know, WH or Y, I don't know, said that paratransit services will be eliminated on certain routes, but that they'll still provide some paratransit service consistent with federal guidelines, aka they're not trying to get sued, which is some bullshit. So this is going to have pretty horrible and wide-ranging impacts on people with disabilities, especially Black and brown low-income people with disabilities who rely on public transportation to get to doctor's appointments, go to their jobs, get to school, etc., because people with disabilities utilize public transportation at a higher rate, and that's for a whole host of reasons, whether they can't drive due to disability reasons, whether they need accessible public transportation because they could drive, but they can't because they can't get a car, because they have asset limits due to the social programs they're on, like SSI or Medicaid or what have you. Disabled people also need public transportation because, we can't just like navigate the city the same way non-disabled people can. Like, sure, maybe a non-disabled person doesn't want to walk 6 blocks in the city because it's hot out or something, but that's like a life or death situation for someone with heat intolerance or other, you know, chronic disabilities or just general health conditions that they have to be mindful of. But that's also to say that like this city is accessible and walkable for non-disabled people, but like the sidewalks and construction and just general stuff around like is completely inaccessible. Our sidewalks are not safe. So some people with disabilities have to, you know, get off the sidewalk and go into the street and risk getting, you know, hit by a car or something because the sidewalk is inaccessible. So these are just like so many things that people without disabilities aren't thinking about, of how these cuts are going to impact disabled people. One other thing I've been thinking about is how having no paratransit is going to force disabled people to use rideshare apps to get to where they need to go. So things like Lyft and Uber, and how those rideshare apps are, one, like ridiculously expensive, way more expensive than paratransit, and two, like there isn't an endless supply of accessible vehicles in Philly. Like in the few years that I've lived here, I've seen like somewhat of an improvement in the use of accessible vans and things on those apps, but I don't even remember. But I don't even think right now you can schedule those in advance in the same way that you can schedule like a normal Uber to like pick you up early in the morning for like the airport. Like we don't have that. So how can I know for sure, if there's no paratransit, that I am going to not be able to book a car in advance to get to my doctor's appointment across the city early in the morning and then miss it and then be, you know, like treated as a bad patient or a bad student or a bad employee because I didn't get to work on time or I didn't get to school on time, even though it's completely out of my control because of all of these different factors going on. So this is not going to be good. And if you have the capacity, like, keep talking about this, push that like more news organizations cover the impact on disabled folks, not just on this issue, but tons of different issues. I'm going to try to keep talking about the things that are going on in Philly. So stay tuned.